Many of you know, May is Mental Health Awareness Month. And while we certainly don't need to wait for May to talk about these issues, this is a good time to raise awareness about the importance of mental health and also the reality of living with a mental illness, which is something that millions of American families face every day. And there's also emerging evidence on just how much the pandemic has increased stress, anxiety, depression, as well as social isolation and loneliness for so many of us. And this isn't surprising to any of us who've been thinking about these things for the past year plus. But as we look ahead to what life might look like in the next phase of the pandemic, we thought this was a good time to talk about ways all of us can improve our own well-being and especially support those around us. Today's conversation is being live streamed on YouTube and Facebook, and it will be recorded for those who could not join us live. Participants can use the Q&A function throughout the discussion to submit questions for the panelists, and we'll try to get to some of those questions towards the end. And in order to increase the accessibility of this session, we have both live closed captioning services, and we also have our wonderful American Sign Language interpreters providing services throughout the conversation. We have a great panel for today's discussion. I'm going to ask each of them to introduce themselves one by one, and I'm just so grateful that they've made time because this has been such a busy year for everyone. I'm going to start with Dr. Ram Mahalingam. Ram, can you start us off with a quick intro?
Sure. Thanks, Preeti, for inviting me. Can you hear me? You're okay?
Yes.
Okay, good. I'm a professor of psychology at the University of Michigan, and I also the director of Barger Leadership Institute, an institute dedicated for developing leadership qualities for undergraduate students with a commitment to personal and social development. And that's really the way we think about it. I also study mindfulness and dignity in workplace. So that's the framework I use to think about how to use mindfulness in a way to improve dignity around us, the way we think about other people and how we think about ourselves. And within the larger framework, I study how students cope with this discrimination in workplace. This is the kind of work I do.
Yeah, we're going to get a chance, hopefully, to dig into some of the great work that you've been doing, particularly with the Barger Leadership Institute. Next, my friend, Michelle Riba. Michelle, can you introduce yourself, please?
Sure. Thanks so much for inviting me, Preeti, and to be with this wonderful panel. I'm Michelle Riba, clinical professor of psychiatry in the Department of Psychiatry. And with Dr. Sagar Parikh, I'm co-director of the Workplace Mental Health Solutions program within the Eisenberg Family Depression Center here at the University of Michigan. And I'm also past president of the American Psychiatric Association.
And Michelle is also like grandmother to the world. I feel like whenever I come and see you, you feed me, which is always fun. But anyway, again, so many great identities, and your work has spanned so many different things across the world, not just in the United States. So thank you for taking time. And next, Dr. John Pate.
Yes, hi everybody, and thank you for the invitation today. I'm John Pate. I'm a professor in our School of Public Health here at the University of Michigan in our Department of Health Behavior, Health Education, and I direct the Center for Managing Chronic Disease. Over the years, I started my focus on chronic medical illnesses, and we still do a lot of that. But over the years, we've been focused more and more on mental health and some of the other issues that we'll be talking about today, because it's just become, so important for people living with chronic illness and everyone else in our society, especially in the time of COVID. So the good news is there's a lot of positive things I think we can do for mental health, and I'm happy to have that discussion with all of you today.
Yeah, thanks, John. And one of the things I love about John's work, and John, we've worked closely actually on loneliness and social isolation through our work on the National Poll on Healthy Aging, and I've learned so much from him. And I know during our discussion, I'm hoping he can share some of the actual actionable things that, it's not just talking about that this is difficult, this isn't good for you, but here are some ways to actually make it better. And that's what I just love how the implementation of your work. And then finally, we are joined by Caitlin DeVries, who is a graduate student and also in School of Public Health. Caitlin, you can introduce yourself.
Hi, everyone. My name's Caitlin. I'm a Master's of Public Health MPH candidate for 2022. My focus is in general epidemiology, and I'm really excited to talk to you all today.
Thank you. So let's start today's conversation by addressing why we are here. First of all, we're having this conversation, which is a first step. We've not always had these kind of conversations. And I think what I'm referring to is stigma and ways we can reduce it. And I think the world has really improved in this regard, but I want to ask some of our panelists about this. In the past, there's been a lot of stigma around mental health, talking about it, and certainly seeking care. And this is something that people have felt the need to hide or like not talk about. And we really hope that a conversation like this one is going to help change that. But I'm just going to throw this out to anyone on the panel. How can we further reduce the stigma, particularly in groups maybe where there still is concern about talking about mental health? John, you want to take it?
Sure. I think one thing that we can do, and I think that we're trying to do pretty, is get away from the idea of mental illness and diagnoses like, oh no, I have clinical depression, oh no, I have anxiety disorder, and talk more about symptoms, feeling anxious, having trouble sleeping, having trouble getting going. Those symptoms are something all of us have. They might qualify someone for one of those clinical diagnoses and maybe even a prescription. But it's part of the human condition. And I think if we recognize it as such, kind of destigmatizes those symptoms and their effect on our ability to kind of function and enjoy our lives in a positive way, and kind of opens us up to solutions.
Yeah, I love that. And, always wise. And, I think even I struggle with the language sometimes. And actually in my intro comments, I even use the word mental illness. And I don't actually know what the right term is. We talk about well-being and self-care. And I like that idea that this is the human condition. And frankly, we all have moments where we're doing better and we could do better. So I really appreciate that. I guess it comes from your chronic conditions work also, the idea that this is part of who we are. Wondering if the other panelists want to just talk about ways to decrease stigma.
Yeah, one of the positive things that have come out of the last year and a half, the pandemic, racial injustice, economic upheaval, but it's given us the opportunity to talk about health and the determinants and social determinants of health and mental health problems, because it's impacted on all of us to some degree. Nobody has gotten out of this, really. And so it gives us a way to think about resilience, prevention, coping, and how to do better, in the future. And that's some of the positives that have come out of this. And, having opportunities like this today and thinking about mental health using other media, not just talking about art, music, writing, or other good ways to think about this and decreasing stigma.
Kate, Ram, if you want to comment.
No. Okay. You want to finish something? You started.
Yeah, I was just going to say, Caitlin, from the student perspective, I'm just wondering, obviously, you don't speak for all students, but, what have you observed during your time at Michigan and maybe before Michigan?
Mm-hmm. So I think, first of all, we need to discuss how common any mental illness is in the United States. In 2019, SAMHSA estimated that 1 in 5 Americans live with any mental illness. And for younger people, depending on the study, that can be up to 1 in 4. And usually 1 in 2 people will experience some type of mental health condition in their lifetime. So this is an incredibly common event. However, living with mental health conditions or even just experiencing some of these symptoms can be really alienating. So I think in academia, it can be really hard to talk about what's going on, and you don't want to feel like you're the odd one out. But in general, I think it's really important to reduce stigma, to talk about it, and to do things like we're doing today, and to almost commit to a normalization of, yes, this is a human condition, and yes, you're not alone if you're experiencing these things.
Yeah, really wise. Thank you. And Ram, did you have a a comment?
Yes, I think John and Caitlin, I agree with all Michelle's point of view. What I'm thinking is there's stigma, but we also need to really, as faculty members, as institutions, commit to the idea that we are open to helping students who are, like, for example, faculty members have to say, if you have an issue, contact me. I'll be happy to work with you. Things like that. I think there should be some institutional culture that reflect um, underlying the issues. John said it's a normal process. It's being a student, being a learner. We go through this. I tell my students, for every one paper I publish, there are 4 papers I did not publish, and they actually don't know that how many things I fail, and I'm constantly auditioning, as if I'm auditioning. Every paper is I'm auditioning. In Hollywood, there's only 2% chance of getting a role if you're auditioning, even if you're Marlon Brando. But I have at least 10% of a chance of publishing in Nature, which is pretty good if I can. So I tell students this is something you need to understand, the uncertainties, the transient nature of some of these experiences. Some of them you need really help. So you need to identify how these things and how to talk about it. And I think how to signal these things to students at creating a culture of inclusion where I think the inclusion should also include mental health as an important issue of the diversity inclusion um, initiative has to incorporate this too.
Yeah, no, that's a really good point, is that we don't always talk about our, I don't know if you want to talk failures or whatever, like the times we fell down. And I was a student here a long time ago. And I just say, like, I fell down 50 times, but I got out 50 times. And I think I learned a lot from that process, but people might be really surprised to learn about the journeys that many of us have taken. And it was like, winding road. So yeah, I really like all those points. So how we talk about it, the words we use, letting people know that you're not alone. And then also talking about challenges that we faced. And I love that we're always auditioning. So just going to move on to a little bit different topic. We talk about how important it is to have people around us who are supportive, and that we use the many resources that are available on our campus to manage our mental health in the community. And, Ram, I want to talk a little bit about self-management. And I know that you've done a lot of work on this, and you mentioned in the introductory comments the idea of mindfulness. Can you talk about self-management and mindfulness and how that might fit into this conversation, really, for all of us?
I think the one way to think about is to think of broadly some of the stressors students experience. One is academic stress. So what class you're taking, how to manage the demands of a course or multiple courses, what sequence you're taking those, and how to talk to faculty members, negotiate things. If you need an extension, how to talk about these things, questions like that. Then there is also what I call the identity-based stress or intersectional identity stress, where being ethnic minority or all the other stresses you are experiencing because of your identity, safety, all kind of stuff, Black Lives Matters, all these issues, and family members. So you come from first generation, like myself. I'm a first generation graduate from my family. Both my parents didn't finish high school. So how I don't know much about this. There is a hidden curriculum how to understand these things. Oh, everybody got this internship. I didn't know about this. That sort of a knowledge, lack of knowledge, access to this. Then I also call what I call the misconstrued academic conceptions. Oh, everybody is doing well. I don't have this. I need to do this. So that kind of a misconstrued representation of who you are, and that lead to like imposter syndrome, social invidious social comparisons, and perfectionism. All these lead to procrastination, more stress. And I think that's where mindfulness will be helpful. Mindfulness helps you to really see the transient nature of things. Things are changing all the time. It helps you. It also helps you to cultivate compassion. First of all, self-compassion, compassion towards others. It helps students to connect to the communities. One of the things, because the stress happens, is you go inward in the sense you disconnected from your own, how you feel, your own emotions, how you talk to other people, and you connect to the larger world. So in my work on mindfulness, I use a more holistic perspective. So I have some ideas from Buddhist psychology, some ideas from social justice, focused my work I've done. So I integrated them to talk about compassion, sympathetic joy. 7 features I have: compassion, sympathetic joy, situated intersectional awareness, talk about identities, how it affect your life. Wonder, generosity, cultural humility, negative capability, how you think about um, some of the things when we do, we very uncomfortable side of who we are. Certain things we don't get it. That means I'm not dumb. So I need to work with compassion, my own incomplete knowledge. Knowledge is incomplete, my learning is incomplete. How to really navigate this, right? So students need to have tools to develop to look at each and every piece of this so that they have a very holistic way of thinking about mindfulness to navigate this. So I teach a course I've been studying for more than 10 years, looking at how these things help students to really develop an identity and develop a vision, what I call a vision for dignity, how you're going to lead your life, where you are connect to your values so that values guide your actions. And all your learning helps you to identify the process. That's all we do in school, fundamentally. That's what institutions are for. So try to help them to reconnect, not thinking in small pieces of, I'm going to do this, I'm going to do this. Okay, why are you doing this? Try to talk the big question, like John said, we are all in this together. We all go through this. So why are you doing this? So mindfulness provides them this sort of a space to explore that so that they can engage with these questions phenomenologically based on experience. I use poetry, painting, art, everything to help them holistically think about it, holistically express it. If you have a learning disability, you can paint. Students can do a final project which could be a complete painting or a poem. They can just write poems on instead of reflection papers. They can do that. People have done all of them. And one student made me her favorite songs to answer some of the questions. She gave me a little album of songs. So you'll be surprised how students can be creative to really connect. They actually deeply think about these things. But once we find the way to help them to connect, find a modality that works best for them, or modalities of expression. So I think that's where a lot of our next step in higher education is going to be. That's a challenge.
Yeah, I love that. And the theme that comes to my mind as I'm listening to is purpose. And yes. I know John talks about that too. And some of our other colleagues at the School of Public Health, especially like Vic Strecker and others, like this idea of purpose.
Yeah.
And that connection.
Yeah. Mindfulness, we talk about intention setting. So I'm said, if you're going to watch Netflix, put it in your calendar, watch 2 hours of K-drama, which I love watching. So that should be intentional action instead of wasting my time. I feel like I'm wasting my time after 2 hours. So you don't enjoy what you did. So make sure that you're intentional about what you do. That's what I teach students.
Yeah, no, those are good tools. And I know that your course, and we'll talk about it in a bit, hopefully, really offers some of these life skills. And, the one other piece that comes to mind is sleep, and particularly for our students. And poor sleep and what that does. And I, as a parent of a current student and also a senior in high school, like it's just amazing to me when the stress, when it bubbles up, it's often fatigue and that end of the semester. So good. So John, I'm going to shift a bit, to talking about public health, and we've talked a lot about public health this past year. And probably when I mention public health, a lot of people think about what I do in infectious disease and epidemics. And, we've been talking about mental health, but can you help give us context as mental health as a public health concern?
So first, just to put a little bit of a finer point on it, Preeti, I think what we're mostly talking about today is what we call mood disorders. Like, we're not necessarily talking about mental illnesses like schizophrenia or organic brain syndromes, thinking disorders. We're talking about various types of depression or various types of anxiety. Those are separate things. They often go together, but they're those things that make us feel emotionally bad and often interrupt our function. And it turns out that one of the fundamental symptoms of mood disorders is feeling overwhelmed, feeling hopeless, feeling like there's no way out, not being able to see solutions. And I think one of the reasons that you'll hear that all of us are so enthusiastic about this as a public health problem is because we're basically scientists, and these are evidence-based approaches. What Ram was just talking about in terms of mindfulness, there have just been dozens, maybe hundreds of studies, Ram, that have shown very clearly that these approaches work. So, if you're struggling with a mood disorder, if you are depressed, if you're anxious, don't take it from us. Don't take our word for it. We're just asking you to kind of have an open mind and try some of these things out for yourself. And the evidence suggests that some of these things will work. And as Preeti says, you know, that's, for me, that translates into public health. So Preeti, you mentioned sleep is one of the basic things that it turns out helps mood disorders is getting your sleep on schedule. You know, just being serious about your sleep schedule. That's important. Physical activity, studies have shown, can have as much of an impact on depression as an antidepressant medication. And we just don't say that enough, you know? So I'm religious about my physical activity, not only because its effect on my body, but because of its effect on my mental health. It really makes a big difference. As we said, when you get depressed, it's really easy to become a couch potato and just forget about it. As soon as I feel better, I'll go back to the gym. But really make that effort, because once you get more active, even just a little bit, you're going to feel better. So we have physical activity, we have sleep matters, certainly substance abuse. Let's just talk specifically about alcohol. There's a common, you know, perception that like people are self-medicating, right? So that's like, well, if you are as depressed and anxious as I was, you drink too. Turns out as much of the relationship goes the other way. It's not that you're drinking because you're so anxious. You kind of become anxious because you're drinking so much. So getting that consumption of substances under control is something in a public health sense we're trying to do to address this epidemic of mood disorders. Now, the last two I'll mention just very briefly is, as Preeti said, our relationships with one another. Even those of us that are really kind of introverts, you know, kind of homebodies, we all need, you know, meaningful connections with other people. We're social animals, we're herd animals. So keeping track of those relationships and trying to have some meaningful interactions with other people is really, really important. And finally, you know, what we really try to work with our students especially, but really it's something that's affecting everyone, is overuse or misuse of technologies and social media. Doom scrolling online, becoming clearer and clearer. Yeah, isn't a great term? Doom scrolling is becoming more and more clearly linked to anxiety and depression. It gives you the illusion, it's kind of like the junk food of relationships. Like it gives you the impression you're filling yourself up with social context, but you're not. There's no nutritive value in those types of social connections. So we really want to live.
Yeah, I love that. That it's the junk food of relationships. And you know, I think I mean Caitlin is maybe the exception, you know, having you've grown up with technology, and I'm going to talk to you in just a minute, but you know, just want to reflect on that, John, like as parents, as instructors, I mean, what are like it's hard to tell someone, I mean, I've tried to say, put your phone away. And I know we're going to talk about Ram and his setup at Barger, but do you have any advice like for families who are trying to, you know, particularly during the pandemic, you know, your whole life is become virtual. It's very abnormal for any of us, but for little kids especially. But do you have any advice, John, like for families and parents, like to say how to address that technology issue?
Yeah, two quick things. One is, yeah, one of the ultimate lessons of our field of trying to help people make any behavior change is nobody likes to be told what to do. Nobody likes to be lectured to, right? So as soon as you get into like you should, or I'm worried about how much you're lost. You can't do it that way. That's why kind of I'm trying to present this is just like, hey, give this a try. If it works for you, it seems like it probably would. Being open, and that's what we call this motivational interviewing style, right, is really what makes a difference. My other thought would be that when we think of helping someone lose weight or change their diet, it's often at least as effective or more effective to think of not what foods you're going to cut out of your diet, but what foods you're going to increase. So increase the amount of high carb or low calorie foods. And almost by necessity, you're going to be eating less chocolate cake and cookies because you're going to fill up on those other things. Same thing with our life online. rather than telling people, hey, get off your phone, put your phone down. If we can help them think of other ways to be active during the day, again, being physically active, seeing someone in person, doing other types of meaningful activities, they'll almost just naturally be online less, and that will be helpful.
Yeah, that is really great advice. And, as we're starting to get back to our like real life world where we're not just like in our virtual worlds, I noticed over the weekend, getting together with friends, I had like set my phone down somewhere I don't even know. And like all of a sudden 6 hours had gone by and I hadn't looked at it. And it turned out there were a lot of important emails, but I'm like, like how important could it be? But I think, that's something that, we all can incorporate, within reason. And I also like the point about exercise. And this has been something difficult for people where their usual routine with the pandemic. And I can speak for my own, parents and in-laws. And, and I've told them, I'm like, listen, just go back. You're vaccinated. Go back to the gym. Make sure it's not crowded. I know not everyone agrees on this issue, but I'm like, rates are coming down. It's more important that you go there and stay active so that your mind and body are healthy than that teeny tiny risk that you might take of COVID, as we're learning that vaccination has been so effective. So, hopefully people are getting back to routines, and of course the weather's beautiful. Kaylin, you're also studying public health, and I would love to hear sort of your perspective as a graduate student and as someone who is training to be a public health expert. How do we examine mental health through a public health lens, and how does that relate to particularly the student experience?
Sure. I want to touch upon the social media use. I think as students, we were doing school through Zoom school, and a lot of our communication with our peers was virtual. So I think creating that supportive environment, sending memes to your peers, appropriate memes, and just really being supportive at the end of the semester, like the light is at the end of the tunnel, you're almost there, was really important. So even creating the community wherever you can was really beneficial for a lot of students' mental health. Going for a walk now that the weather is nice is really nice. But for public health especially, it's important to be knowledgeable about the different comorbidities that can occur with mental health conditions, about marginalization that can happen, that can negatively impact public health, especially mental health, and also the protective factors like having a community, physical exercise, having a friend, or a supportive person in your life to talk to. All of these things is what public health practitioners specializing in mental health really want to focus on and bring light to and educate people about.
Yeah, it's sort of like having an instrument and using it properly, I guess, and I've heard of, like certainly within my family, like the Sunday evening Zoom with all the cousins, and those were really cool. And like to some extent, we communicated more. We were more connected than ever. Although, after a few months, it kind of petered out, and we're kind of back to our usual thing. But I really like those points around social media, and and I will say as a parent, I do see my kids using these things for good also. So. Okay, I'm going to shift gears a little bit, and Michelle, I want to talk a little bit about depression specifically, and we've talked about symptoms and we've talked about mood disorders, but depression in particular affects a lot of people, and I think the stress of this past year has created really grief and loss for so many, and I think some people have who never had concerns have concerns now, and they're sort of re-entering with some difficulty. And when we look at polling, we're seeing numbers of people who have these symptoms increase. There are lots of resources at our university to help manage well-being and mental health. And I want to talk particularly about some of the resources at the Eisenberg Family Depression Center. They, of course, you and others, you mentioned some of your work, but if you want to just talk a little bit about some of the resources and what your experience has been.
Sure. So thanks so much. So the Depression Center originated 20 years ago here at the University of Michigan with Regental approval. Dr. John Graydon was the founding psychiatrist, and the baton is turned to Dr. Sarijan Sen, who's the director now, and Dr. Patty Delden, who's the deputy director. and it's called the Eisenberg Family Depression Center. And the goals and mission of the Depression Center are to research depression, bipolar disorders, prevent mood and other mental health conditions, do research and impact on public policy, and decrease stigma, and provide clinical care. Something very important to note is that 75% of all mental health conditions develop by the age of 24. So compared to a lot of other chronic conditions that often start later, we need to recognize that many of our students are coming to us, and as Caitlin mentioned before, about 1 in 5 or 20% may have had an episode of depression or anxiety, even before coming to college. And we also have faculty and staff who want to be able to help. So we have a convergence of need and desire of all of us to want to do better. In addition, the trauma of what has occurred in the last year and a half is very important to acknowledge. And we can think about it as a PTSD, a post-traumatic stress disorder, or symptoms that many people may have, not for weeks or months, but even for years. So we need to sort of put that all together and recognize that one size may not fit all. And the idea about trying to get people healthy and meeting them where they're at is going to be the task for the future. And not everybody's going to need a full panoply of psychiatric help, but there may be some people who need that, and how to figure that out and how to give people what they need at the right time with the right kind of care is going to be the challenge for us. The good news is that we telehealth and other ways to provide mental health assistance, either on an individual basis, either by groups. And the Depression Center is working very hard, and with you, Preeti, and other teams here at the university, to really look at all the resources at the School of Public Health, the kinds of resources that we can bring to bear for all of us, because we're all going to be needing this over a course of time.
Yeah, it's almost like I'm thinking about this a lot, and I find it interesting, Michelle, that you use the term PTSD, because again, I'm conscious of and I'm thinking about John's comment too about we're using these terms and really what we're talking about symptoms, but PTSD is something pretty particular, and I appreciate that you use that term, because I think there is something for folks, and maybe in some ways a comfortable feeling of what it felt like a year ago, where I was all cozy in my house, and now I have to go out and I have to re-engage, and I'm concerned, I'm worried about infection. But I've just seen the distress that people have felt in the past year, and others who've done okay, and I think some who have adjusted expectations successfully. And I know that both John and Ram are part of these committees, these campus-wide committees that are really thinking, both the provost as well as the vice president of student life are supporting these committees, are sponsoring these committees, are really thinking more holistically. And I know, Michelle, like you said, we've had these task forces for 20 years, but it's this is this moment where it's no longer optional. We got to adjust and adapt. And as I think about our entering students and what they've experienced, we're going to have students starting in the fall who are second years who've never set foot in a classroom here, have no connection to the campus, unfortunately, beyond Zoom. And then there's another set coming in as first years who haven't been in a classroom in a year and a half either. So I think it's going to be interesting, but I'm actually very hopeful and optimistic. My belief is that a lot of people are going to come here with open minds to really engage. Anyway, I hope so. I don't know, Caitlin, if you have any other thoughts from a student perspective, if there's things that we should be thinking about, beyond what's already being talked about.
I'm going to be a part of those second years, second year of my master's degree, that I will go into the School of Public Health, having never been there before. So I'm really excited for that. A little nervous. I think it's also important when we talk about the reintroduction of campus and students is that we also provide a space for students with parents or themselves that are immunocompromised, and we create a culture of accountability, safety, and
Yes.
just acknowledging that we understand that there are going to be new struggles, and that while some people may be really excited to start, some people might be a little more hesitant, and that we're going to acknowledge those too and create a supportive community here for them.
Agree. I think everyone is sort of at a different point, and hopefully we will all work together to support everyone. I believe we will. I'm going to move over, to Ram. So back when we were like meeting people in person, I guess we're starting to again, thankfully. One of our mutual friends, wonderful friend, Preeti Shah, who introduced us a couple years ago. And I was so grateful, you invited me to come visit your physical space at the Barger Leadership Institute. And I was so struck by it. And actually, it was the place where I used to take physics lab, a million years ago. And now it's like this, like beautiful, like there's plants and cushions. And, one of the things I wanted to talk about is this idea of creating supportive environments in our college, spaces and in residence halls and libraries, at home and workplaces. And, I'm really talking about a physical space. And if you could tell us about the meaning of that space, not just to the students who are there now, but the students who come back to visit you, talk to us about what we can all do to make space for ourselves to have better, I don't know, I just function better. So
Right. Thank you. I think I have very good two Preetis. So Preeti may be a good name. One of my colleagues. She was my senior in grad school too. So I've been following her for a long time, Preeti Shah, and she introduced this Preeti. I think Barge Leadership Institute. It's in Weiser Hall. We are on 8th floor. If you come to 8th floor, we have a common space. One of the thing I've been noticing for students, I teach meditation. They come to my class, do these things, but there is no dedicated space for them to reflect, to be contemplative, a space to connect to themselves, to other people, right? So that's, we've been thinking, staff, my BLI staff, Body Leadership Institute staff, and we've been thinking. So we decided to have a contemplative space. We have a dedicated room. They come every 2 weeks. They can come. So we also have crayons, painting tools, watercolor, everything you need, cushions, everything is there. There are only two conditions. They have to leave all the electronic devices outside. We have a person, dedicated person, keep all your phones outside the room. Inside, you cannot read a book. You can write, journaling you can do write poetry, anything you do, but that space is dedicated like this. We also have prompts for you to help you how to think these things. Suppose you got stuck here, how to write a poem, what are the prompts you can use? So we have different contemplative activities, poetry writing. We also run workshop throughout the year. We are going to open to the university this time. We were doing it for our fellows. Now it's going to be open to the university. So anybody can attend. We have a poetry workshop, contemplative writing, contemplative painting, then meditation if they want to practice. So we are going to open the spaces like that. So the thing is to help them to really see this as a space for them to reflect and, and connect to themselves. The connection is important. And they need some help. And also, like John said, instead of telling don't use technology, we are saying leave the technology. This is something you can actually do proactively and see. And the students tend to like it a lot. And creating that such a space and students take it in a different level. Our project fellows do one thing right before the exam. They call the stress fest. I think I was about to call Preeti that year. Then we had this COVID. Otherwise, I was planning to invite for that. They have all the popcorns, all the junk food you want to eat, and hot chocolate. And we also have somebody comes and give the neck massage. It's sign up for 10 minutes for the students. They about 600 students rotate through the day, 2 days before the exam. just relax before the exam. So it's organized by our students. That's really more physical caring, where the nurturance part is important. We actually provide, our food budget is pretty good for the BLI, which is we are feeding people all the time, which is important. I think that's the kind of idea how to nurture both spiritually and materially, and providing a structure for it. And I know there are other dedicated spaces in the university. You can go to library and other places. But what we did was we have somebody who can also provide you tools, a secular tool. You can actually use it to work in a way. And we are going to, I also curated a 6 weeks contemplative journaling, a mindful journaling series last year called Pause, Reflect, and Create. So that every week I send them 1 week what you can do. So you can do a guided meditation, plus you also do the writing. So 6 weeks, a lot of students have done that. Many staff from the university also participated in it. So they're all available. All the resources are available. Happy to share it with you.
Yeah, I love it. And, again, having seen the physical space, it's just lovely, but it's also not anything extraordinary in terms of,
Yeah.
You could do this in other spaces. And, I hope we can maybe think about replicating that type of feel in other spaces. So thank you for sharing that. I'm going to keep moving on. This is kind of one of our, I don't know if we're getting not quite to the end here, but this is sort of the big question is, I'm going to ask everyone for input on this, is how do we continue to change the narrative and just normalize these discussions and things like your mindfulness den, whatever it's called, Ram, this idea that, this is just part of who we are. It's part of our human condition. And, perhaps in spaces where it has not traditionally been normalized. If each of you want to weigh in on additional things we can do, maybe I'll start with John.
Yeah, I mean, I don't know if I mentioned before, but, like many of us, I work a lot internationally. And one thing that's positive, I guess, about COVID is that it provides kind of a common experience that all of us have gone through all over the world. And so for the first time ever, a lot of people, again, almost across international boundaries, you can talk about feeling afraid, feeling depressed, feeling frustrated, handling, a lot of unknowns. So we have this kind of common experience. And I think that has really brought us together. Before, as has been said, there's always been anxiety and depression among many people. As I think Caitlin mentioned, so many people in the course of their life are going to experience these negative emotions, but not necessarily everybody experiencing it in the same way. And so people, I think, did feel much more isolated, or it's hard to kind of talk about it. Now we can talk about it. And right now we're talking about it in the context of COVID. Long after COVID, these things are going to be there. So having kind of recognizing our kind of common experience, our common experiences as students, our common experiences as academics, and having these conversations just like we're having today, I think is one of the most positive things we can do.
Yeah, I like that. I think I hadn't thought about that, but it's true. Like everybody in the entire world, and for that matter, in our community too, has experienced COVID, has experienced the pandemic. I mean, it has been a different experience. I certainly, like all of us, even on this panel, have had a very different experience. But, and again, you alluded to your international work, John. I just, we didn't talk about it too much, but I love, again, that actionable aspect of it, like the loneliness and social isolation work that you do. And, I hope maybe as students come in and as faculty come back to more face-to-face teaching, some of these discussions on like just that, hey, we're all at this point, like we're all kind of, each of us is trying to figure this out, and then maybe using that as an opportunity. I don't like to really talk about silver linings, but I hope that there are some good things we can keep from this shared catastrophe. So thank you. Michelle, what are your thoughts in terms of this conversation and maybe bringing it to spaces where it hasn't been normalized?
Yeah, when I was listening to Ram talk, I was hearing a lot of creative, innovative things that you and your colleagues have been doing to try to improve your students, well-being. And I think going forth, it would be great if we could give ourselves permission to try some new things. We're very steeped in evidence-based and, tradition in medicine, but, we need to change, and we have been changing in the last year. It's hard, but a lot of good things have occurred in the last year and a half. We've learned to, change the model of our care, doing telehealth and, the idea of somebody having to come in physically and park and meet with us. We're probably not going to go back to that. We'll probably have hybrid models, and that's really good. And so in the same ways, trying to introduce other ways to care for people and having conversations about that, what works and what would be helpful, seems to me to be a really good way to think about going forward and, incorporating things that we'll learn from one another. And so, having, and then having opportunities to share those experiences, with colleagues, with students, and being very open about that. So I'm excited about that part of that. And I think you are too, pretty, about sort of trying some things out and seeing if it works.
Yeah, I think it's one size doesn't fit all, right? And I appreciated in your introductory comments too, Michelle, you talked about sort of that prevention, that upstream piece, and that's what we're talking about is, campus wide and a lot of just stress on people. I don't know if that's the right word, but just difficulties and the idea of caregiving during the pandemic and how hard that's been for people, whether it's children or older adults or someone in between, much less yourself. And trying to this I remember last fall I said this is like having 500 snow days in a row for parents. Like it's just, and having experienced those snow days and the difficulty of figuring out 1 day or 2 days, this has really been challenging, and it's going to continue to be challenging in the fall. So
yeah. And Caitlin was saying about she's a second year, but in some ways a first year coming into this building, where you're going to be. And so we're going to have to treat everybody, really ask questions about how you're doing and how we can help. And, even though we're tired, we're all going to sort of have to figure this out together.
Yeah, I have that vision of that where, you go and knock on your neighbor's door, whether it's in the residence hall or in your office or wherever, and say, I'm worried about you. How are you doing? Are you doing okay? And, one of the things I think that's been great for me is that I've continued to work as an infectious disease doctor. I continue to be in my space with my longtime colleagues, and, we might have our masks on, but we laugh and we have this normalcy that I think, I'm really grateful for that. Speaking of Caitlin and getting her to campus, to like a little more of a typical campus, what do you think about this, like this idea of talking about mental health and changing the narrative? And I think I have to say generationally, it is a little bit different, I think, in a positive way, but I just love your thoughts on that.
So I like to think of it as we're all in the same ocean, but we all have different boats. So my generation, millennials and younger Gen Z, I think, are very attuned to mental health. Whereas the older generations, maybe not so much, but we still, have varying degrees of lifeboat access, you know what I mean? So what I think I would like to see more as we transition through the pandemic is more talking and advocating and just trying to breach those different lines and talk about things more so than we have in the past. I think as institutions and as American society, we don't always do the best job of that. And I think we can definitely do a greater job of reaching across lines. And, some people might be dealing with grief when they come back and just, trying to meet them where they're at.
Yeah, I think a little kindness or a lot of kindness would go a long way. I hope that when we re-engage with people, we remember that kindness. I think about last spring where everyone was really exceptionally kind. And then they became not so kind. And then, hopefully we can kind of bring out the best in people. And Ram, thoughts on changing the narrative?
I think we have to really think our institutions as a caring institution. We need to think of higher education as a place for compassion, and teachers should see themselves as the way I think about it is teachers should see themselves as a compassionate leader of the classroom. Whether you're teaching engineering, science, or medicine, you are a compassionate leader. That's the primary identity. But we never imagine them ourselves in that framework at all. We are only thinking of content and pedagogy, delivery, accessibility, and make sure students learn them. They're all important. They're all evidence-based. But also we need to have a narrative about who we are, why we are doing this. And the disconnect often also leads to burnout. So in many ways, being a compassionate leader, teachers and staff need to think those terms, especially faculty members. I think that's going to transform classroom practices in signaling and building trust with students they can open. And of course, faculty members need help, how to help them reach out to students. And that's part of, John, we have been talking about in our committee meetings too, and how to help faculty members to recognize these things. So even framing that your job is not only teaching, you're also a compassionate leader of your class, a caring and compassionate leader. And that gives a different way of structuring your own experience, how you connect with the students. And I think that's where we need to change the narrative. I think institutions need to really think of themselves not only places for higher learning, places for higher compassion and kindness to preserve the human dignity, which is important for all of us. What we think about.
Yeah, thank you. So leading with compassion, it's something that we can all do more of. We've got a few questions from the audience around grief and loss. And I know Caitlin mentioned this, so I'm going to throw this out for the group is, how can we support someone who has had a loss and is trying to work through their grief? And you just look at, it's not just deaths from COVID, it's a change in life, it's chronic illness, it's maybe loss of your home or your business, or loss of people in your community. And I think everyone will have lost something, right? They will all be in like different places with that. But Michelle, I want to maybe start with you on this, but how can we support people in our community, whether it's students or fellow colleagues?
Yeah, we're going to have to try to figure out how we ask and hear and listen to people's stories. Appreciate where they're at and what we can do to be helpful. And that's going to take some time. We're going to have to figure out how to do that in big lecture halls and small rooms, and how this can be done in dormitories or other residence halls, and faculty as well. So we're all part of this. This has affected all of us. So how we can take the time to do this. And this is going to be as important as anything else we can teach in the classrooms. How we do this well. And I think we're going to have to support faculty and staff in doing this. We just can't say just go do this. We're going to have to figure out how to train people and support them over the course of time doing this. Because we're going to find out things that are, just because we're teachers doesn't mean that we're expert at, and we're not trying to make everybody into a psychologist, a psychiatrist, a social worker. We're just trying to figure out how to do the best we can and use our resources very, very well here. And so, I think we've all lost something. Many of us will be very resilient to be able to, bounce back, but there will be people who will have difficulties. And so we have to appreciate that.
Yeah, thank you, Michelle. John, thoughts on that? Oh, you're muted. You're muted.
Apologize for that. Yeah, if you have experienced a loss, a death in the family or some other serious loss, it's important to think about it in terms of short-term versus longer term. loss hurts. Loss is difficult for everyone. And in the short term, you should expect that you're going to feel that and feel it very, very deeply. Now, if you're a year or 2 years out and that loss is still kind of preventing you from moving forward in your life, if you're missing a lot of classes, feel like you're drinking more than you ought to, you're feeling really depressed, you can't work or kind of move forward in some other way or in other relationships, that's when loss becomes really a serious problem that you want to think about. You might think about getting some help. There's more options right now than ever. There was just a really important study that came out that showed that video cam counseling with a trained psychotherapist is absolutely as effective as meeting with someone face to face. So it's easy to do, and they're all over the place. So you might consider doing that. Even some self-help programs can be very, very helpful over the long term. So when I think of loss, as Michelle said, we absolutely we want to talk about it and help people kind of process that loss in the short term, because it's going to hurt. In the longer term, those are the people that I think we're especially concerned about, where it's really kind of not getting better. And that's where you might want to look at some other options to help you kind of get out of that slump.
Thank you. And we just have a couple more minutes. So Ram, anything to add to this? Thoughts on grief and loss?
Yeah, I think John and Michelle, they all talked about it. I agree with all of them. My only thing is we also, as faculty members, create an open space. So this is something, if happen, you can contact me. I need to signal it to my students, which I did. And many of them, some of them didn't even tell me they got COVID, they got infected. So I need to, only through the reflection papers, I found out they were infected. So I told them, I specifically told you that you can always talk to me. So I think creating a culture and where we are valuing this space where sharing and being kind and self-compassion, which is lacking when you're grieving, that's a big issue. And it's a common experience too, people can relate to. And I think that will be creating a culture, being explicit about it, and providing, like Michelle said, we need to provide tools for people how to do that too. Not everybody can do that. I think this is where the institutions have to step up and help.
Thank you. And Caitlin, the last word, maybe 30 seconds, and then we'll end.
For sure. I think if you experienced a grief, or you're experiencing grief or loss, just take it one day at a time. Prioritize what you can, and if it's just getting out of bed, drinking some water, going for a walk, give yourself a pat on the back for that and some self-compassion.
Thank you. It's very wise words. Thank you to all of you. We're just about out of time here for the end. I just want to thank everyone, Caitlin, Michelle, Ram, John, for taking the time to engage in this crucial conversation. And I want to thank everyone for joining us. There will be an article that gets written, and it will have a lot of links to resources on campus. We'll make sure to share some of the resources that we mentioned today. So be well, and we will see you soon.